All right, so welcome to the physical development lecture series around helping coaches understand the idea behind strength and conditioning, especially netball. What we're aiming to do here is, obviously this was developed for some state age netball teams and coaches along the way, but it's really applicable to anyone that wants to do any work around with your younger athletes, especially in the sport of netball. So the session objectives that we're going to work through here are just going through some of the basic female athletes concerns that are really specific to girls and young women and the challenges that present for coaches, just injury, pain, solving problems in that regard, what you need to know as a netball coach to manage those sort of things, and when to refer to somebody else and why you might do that. So, first of all, just covering off what is athletic development. So athletic development is the systematic, sequential and progressive development of all of your athletic qualities in an integrated manner to develop the complete athlete. It incorporates a balanced development of all components of physical performance, so your strength, power, speed, agility, endurance and flexibility. And that definition comes from Vern Gambetta, who is regarded widely as being very, very good in the long-term athletic development space. So how does this relate to age group netball players? So first of all, this is a puzzle piece. So it just goes over all of the factors, or some of the factors actually, that you may consider in how to develop a young athlete. So you can see there it's quite complex. And these are the things that we think about when we're programming young athletes. We're not just programming them for today or tomorrow or next week. We're programming them for 5 years' time a lot of the time. We're thinking about teaching them things that'll come back and they'll be able to perform really well in 5 years' time. So, for example, teaching a young child plyometrics. At 12 or 13, the performance outcome of plyometrics may not be amazing because they're not developed enough to drive enough power through that action. However, what we want to do is develop the skill of jumping, the skill of landing, so that when they're 17 and 18, they can get power and speed out of plyometrics. And that's just one of the examples. Things like developing coachability. It's something that needs to be taught a little. So you need to teach them how to listen, how to ask questions. We're not school teachers, so we want our young athletes to have an opinion and to voice it, so that then we can discuss with them differences. So if they don't believe something's going to work, why is that? And then going back through the evidence of why it will work for them. So the athletic development, as it states on the slide there, it really depends on the person. It's not all about just a cookie cutter approach, as to use a term coined. It's more about like looking at that particular child. A 2 to 5 to 12-year-olds can be very different, as we all know. So it's all about trying to get little things in to different athletes that they really need at that point in time. Some people might need more mobility, some people might need more strength. And that's the sort of things that we do when we've got athletes in our space. As a netball coach, you might just work on some basic landing capability, because we all know that injuries, that's when they happen. Most of the time they happen in landing. In netball. So if we can get them better at landing, you can reduce the likelihood of having an injury that's going to take one of your players out and then make a child unhappy by not being able to play. So the biggest difference between men and women, or girls and boys as athletes, or rephrasing, what has the biggest impact on men and women athletes as a point of difference? Take a moment to kind of consider that. And it's quite simplistic, but it's quite complicated. In that, it's the menstrual cycle. So that has an amazingly diverse impact on female athletes. And over a lot of years coaching female athletes in different sports, that's where you really need to get to know your athletes as individuals, because it affects every single female that I've ever coached differently. There's no two people I can say, oh, well, you were exactly the same as this person. It's just not like that. So. And it's understanding what is good and what is bad. And this lecture isn't designed to go in depth into women's health as such. But if you want advice on that, then you're more than welcome to come and talk to. We've got a couple of people in our facility here who are very, very good in that area, and I'd highly recommend coming in and making a time and talking to them about that if you're worried about any of your athletes. So, very, very basically, menstrual cycle relating to athlete performance. So, researchers traditionally haven't studied women because of the fluctuations in estrogen and progesterone and the impact on study results, which is very hard because a lot of the time we're trying to generalise strength and power studies, particularly from men down to women. And so that can be quite difficult because the evidence might say that, you know, a woman can't develop as much power as a male in one study, and then that's taken because there's not that many studies around. It's really important that's why you've got to look at those individual athletes and what they can produce for you. Estrogen specifically increases lower body fat in women. So when in some cycles, especially as they go through their puberty phases, that can happen in young women. Testosterone, so they've only got 1/10 what a male has in serum testosterone. Testosterone is widely regarded as important for muscle growth. However, there are a lot of challenges around that at the moment in some of the research that's been done, which is quite an interesting area to look at. But young women, I would say, need weight training, or they need resistance training. They don't need tons of high intensity fitness. They don't recover as well doing high intensity fitness over and over and over again. Realistically, my experience would say that twice a week is well and truly enough. If they're also training, even once a week, I'll find that a lot of young female athletes will adapt really well to once a week high intensity work. In terms of weightlifting volume, we always try and start them getting their volume of work up. Most female athletes work better with higher volume, less loading per repetition to start with, and that's probably what we start with. However, with netball particularly, you have to be very careful loading their lower bodies too much, because then you build up too much fatigue, which then impacts their ability to jump and land when they're playing netball. So that balance is very is also quite a finite balance there in how hard you actually push them in gym versus then playing the sport, which just has, you know, hundreds of landings in a game potentially. So in terms of relating menstrual cycle basics, so the injury risk, women or young women are 2 to 8 times more likely to sustain an ACL injury than men. The risk during menstrual cycle is your day 10 to 14, so that's your ovulation phase. Likely it's due to estrogen and the impacts on your joint laxity. So in particular, your ACL is impacted with that, according to quite a lot of research studies. So that's concerning, because obviously an ACL injury is a long-term injury. It's a year recovery. It's often a surgical recovery. So they're the sort of things that we're really interested in terms of preventing, to help your daughter or your athletes, or you as a female athlete, not have one of these injuries. The lowest risk for your ACL injury is during your luteal phase. Pregnancy also increases your risk of ACL injury before and after, and up to 12 months post, like in postnatal phase. That's why if you're going back to netball, we like to have at least a 6-month break between having a baby and going back to netball. And the main reason for that is just to let your body recover. If you're breastfeeding, there is some evidence that says that you still produce the hormone that will make your ligaments display more laxity, which does increase the risk of injury. So we like to have that 6-month phase. You might feel amazing, but it's that jump and landing over and over and over again. And going back to sport after pregnancy, my advice, after looking at lots and lots of women do that now, is really try and tee up, like have a relationship with a physio or a strength and conditioning coach that knows how to get someone back from pregnancy, and have that relationship with them and let them help you get back safely, so that you don't go back and hurt yourself, because, you know, probably worse is trying to carry a baby when you're on crutches. So if you look at it bluntly, so we want to try and prevent as many knee injuries as physically possible by both exercise, but also knowing the risk and understanding that. Okay, so then other female athlete factors being iron deficiency. So we're seeing a lot of that, especially in young female athletes at the moment. Evidence-wise, they talk about dietary input, which isn't the place for this lecture right now, but green leafy vegetables are especially really important to try and increase the uptake of iron. Your menstrual cycle can have an impact if you lose a lot of blood in every menstrual cycle, and that's something you need to go and speak to your GP or speak to a women's health physio about if that's happening, and you need to do that early so that then they can start building a plan for you. And maybe that might include, which isn't the scope of this, but it might include, iron supplements quite early in your teenage years to help you not have this. Iron deficiency is a classic. Like you'll just have a female athlete that's really tired all the time. They'll display non-motivation to exercise, which is not normal, but that's one of the symptoms because they feel so tired. In terms of mental health, so it's increasing in frequency across teenage years. It can affect concentration, attention, motivation, rational thinking, decision making. So again, it's just knowing that athlete and understanding and looking for those changes. And disordered eating. So if you're a coach and you're seeing athletes not intake enough food, having things that aren't right. Again, not the scope of this particular presentation to dive into this very deeply, but if you think something's wrong, speak up early, ask questions, talk to parents, and just notify that something isn't right so that then you can go to somebody who'll help you or help that athlete make better decisions or be healthier in terms of eating the right amount of food at the right times to help their performance. So then, injury and pain in young female athletes, especially in netball, what we see is anterior or front of knee pain, which is centered across your kneecap, above or below. So that's called jumper's knee if you look at a nickname for it. So you can have a tendonitis of the patella tendon. You can have patella joint issues where the patella will not sit in the groove that it's meant to sit in very well. And so that is, get onto that early. That's my advice. Don't let it linger because it will just become a thing that stops that athlete from wanting to run it hard and stop. I would say it's quite common. It's one of the more common injuries that you'd find that sits in this background and affects someone's ability to perform. Joint instability, so that's as a risk factor. We've talked about the ACL risk factor there. What does it look like? So in terms of, there's a thing called valgus. So what does it look like? It looks like this and this. So where the knee drops like this. So we're putting pressure through this here and we're twisting. Like it's a pivot shift injury. That's a lot of the time we land and we get a knock that way, or we push in this way and the foot stays this way and the whole body twists. So essentially you're getting your tibia and your femur, essentially they're twisting against each other, and the ACL sits across and it's trying to stabilise the tibia and it can't do that and breaks. You've got meniscus, so that's your shock absorbing, especially on the inside of the knee, so that gets impacted as well. And they're the sort of things that we're trying to control a little more and get athletes better at landing in a squat position, an athletic position like this. There's lots of factors that go why that happens. We're not going to go into that massively, but if you're seeing that a lot and you can't correct it by simple cueing to sit here as opposed to there, then that's when it's good to refer early, because if you go physio, you go strength and conditioning coach early, we teach that, then you're not sending them to us broken, you're sending them to us saying, can you help their landing control? So landing is when we hurt ACL. In general, land, valgus, and then injury. So as a coach, that's the thing you want to look at when they're doing their warm-up. So often when I'm looking at court side, what I see is when an athlete goes to warm up or team, the coach doesn't go with the athlete. So that's one of the most important times for you to assess what is happening with your athletes. It's where you can pick up that someone isn't moving correctly the right way. That's where you can pick things up early, and then you're not having to deal with an injury after. You've picked it up and said, what's going on? Oh, I've got some knee pain. Why have you got that for? Okay, well, what should we do about it? And then you can have the conversation before then you've got someone that's in tears saying, I've really hurt my knee. So just some things there just to look at what does it look like, recognise it. If you can't give some simple cues, it's not your job to fix it. That's what our job is. And then ankle and recurrent sprains, again, really common, landing, hitting someone's foot, rolling over, or just chronic ankle injuries because it never gets rehabilitated properly. So simple things you can do is test your balance. So right now, just stand up and test your balance. So can you do 30 seconds eyes open, no loss of balance? So loss of balance is this, moving around, not understanding that you've got to be still. You've got to be able to hold this still. You've got to be able to control your balance with your foot. And then 30 seconds eyes shut. So can you then shut your eyes? What happens to you when you close your eyes? So that's looking at proprioception, which is the understanding of where you are in time and space without using that visual system that you used, centre yourself, on a point on a wall or something like that. So we want them to be able to do that for 30 seconds. So greatest balance exercise ever, doing it in warm-up to try and stimulate that every single time. You might have athletes averaging 10 seconds first, but then what we want to do is we want them to average 30. We want them to do one lot of 30 and just be able to hold on to that. So they've demonstrated in a research study that if we can get that to 30 seconds, we do reduce the risk of ankle injuries. Get it to 60, reduce it even more. Good thing, tell them, go home every night before you have a shower. Do this in the hallway, in the bathroom, or just before the bathroom, and just tap the wall and just, shut your eyes, tap the wall, and then hold on. And try and get to that 30 seconds. Then shin splints, another factor, so increased running or jumping load. So when you get them back after the off-season, get them all to say, how much have they done? What have they been doing? Have they been playing touch fastidiously for the last 10 weeks and they've done a massive touch carnival? The first week might be just an easier week. You might need to just work them in. Don't go back to hard work straight away. Increase in load is the most common thing that we would say that comes through our clinic and other clinics, where we increase running load straight away from nothing. Then you got to get the ones that, they haven't done anything for 6 weeks. They've had a rest. And then you put them back in and you make them do, 200 stop and turns and jumps and lands within a session, and all of a sudden then they've got shin pain, which is understandable because you've just overloaded their body. Then you've got poor mechanics, gait patterns and walking, running, jumping, landing, heavy footfall on the ground. So, if you're seeing that when they're slapping the ground with their feet, they can't control their gait patterns, they can't stop effectively, they always have to take 2 steps to stop. A lot of those things can be the inability to produce force quickly. They're sort of things that we would fix. That's not really your job to fix. It's recognising that this doesn't look like it should, and I can't get them to do it even though I've asked them to do it. Then it's not their fault. It's just that they don't know how to do it, or their body isn't ready to do that, or something is going on. They're the sort of people that you can say, look, can you go and talk to someone about this, so then we can get that better, so then you can play netball better. And if you explain the relevance of netball, you're more likely to get a good positive response out of a young athlete. So typical recovery time. So I've put this in there just so that you understand the gravity of what we're trying to do. So an ACL repair is 9 to 18 months recovery to go back to netball. That's a long time. So you have a 15-year-old shooter that is, you think, has the potential to make Queensland. They do their ACL at 15 years and 2 days. They can qualify for under 17s Queensland maybe at 16 years of age. So by the time they're 16, they're just getting back on the court maybe if we're going well. So that's all that time. So you could argue probably 3 months they won't shoot for potentially if they have other injuries with the ACL. It's a long time to spend out of sport. So that can be the difference between someone just progressing through into a Queensland level and then being stuck and not being able to get there, because it's a long recovery. And we need to be able to stop turn, sprint short distances to shoot, and then defenders the same. So anything we can do to prevent it, and good warm-up, good injury prevention work, it's demonstrated that it does reduce the risk. So I can't emphasise enough that we want to prevent, we don't want to fix. Anterior knee pain, the question mark is, it really depends how quickly you catch it and how much load reduction we can do early on to get the patellar tendon usually a bit stronger. Usually that's a strength imbalance issue or a flexibility or a landing mechanics issue, so we've got to fix that. Depends on how long and how bad it's been for how long. Ankle sprain is 1 to 20 weeks. Like if we can reduce the numbers of ankle sprains in netball, you could probably see that you'll have players for longer. You can train them more. The more time they can spend with you training, the better they can get. If they're constantly out for 1 or 2 weeks at a time, it's very disruptive, and you can't make them better. And shin splints are the same. It depends on how soon we catch them and what the cause of the shin splints is. For some athletes, it can be a chronic ongoing thing due to gait issues, and it's not up to us to tell a child that they shouldn't be playing a sport because their body maybe isn't suited to it. It's our job to try and get them to manage that as best as possible and to get better physically. So that's our job. And yes, they might have to manage it with increased load phases in their seasons, but I mean that's something that we might help them with. So then these are some challenges of all around athletic development. So I'm not going to go through these in detail. I'm sure you can look at them and see that's, I'm sure you could probably think about athletes that that you see all of these things happen. So some of your things are your fast versus slow developers. So you will get a 12-year-old that's really highly developed versus a very non-developed child, and so that can be really tough for the non-developed child to understand that by the time they're 18, they'll still be growing, and this other person over here, they won't have been because they've grown so much already, and they're better physically now, but are they going to keep developing at the same level? And then pushing through injury and pain, I mean, it's a very fine line. Like, how much do you do that? I mean, if you bring an athlete to me at the start of the season, I might say, well, can we have 3 weeks off so we can fix this problem, so then you can have them at the end of the season. But if it's 2 weeks before a final and it's really important to the child and to you, then we try and work with you to get them through that, but then have a little rest afterwards. So it is about timing, and when you're coming to a person like us, it's really explaining the context of what is happening in their life right now, so that then we can decide like what we do. We do, with the younger the athlete, the longer term we think, so we don't like to take big risks with younger athletes, especially when that they could have an injury that'll really stop them for a while. So we tend to be a bit more careful with that. However, it's every single person's unique in that setting. And then these are just some examples of like athletic development. Obviously not netball right now, but there's some people for swimming and lifting. So just understanding this is one of the things that we want to see an athlete do. So they come to us young. By the time they finish school, they can go and they can train. If we can get them to train in the gym, especially a female to train in the gym and to be comfortable in the gym, then we know that at 18 it's going to make a big difference to their athletic ability if they're worried about going because they are not confident. So our first role as S&C coaches is to develop confidence in female athletes to walk in anywhere and feel confident that they're going to stack up and do their thing, and no one's going to care about what they do, only they care. So part of our role is to develop confidence in their own ability to do a wide range of exercise, not necessarily just for jumping, just for netball, but also a wide range of exercises, so that if they want to go to the gym, as I said, when they're 18, they can just go. So that's why some of the exercises don't specifically relate to netball. Most programs are that from 10 on to 17, you give overall athletic ability, and that's what you've got in mind with any young athlete, male or female. So, in terms of coaching age group athletes, these are like 3 things that I think really important from experience. So, supervision is the best thing. You can help to improve. You can do whatever program you want, like I said at the bottom, but it's the least important thing. The supervision is the most important thing. And feedback and instruction and the style of both are critical. So, layer your feedback. So, I like this. Can you give me more of this over here? Rather than, I didn't like this, can you do more? So, give them, I like what you did, I like what you tried. However, can you give me more of this next time? So what you're asking for more of rather than to assess or criticise. that's something that I use quite often. So can you give me more effort in this power exercise? Can you try and go faster for me? And if the athlete says, I'm trying to go as fast as I can, acknowledge that. I know you are. I just want 5% more. Can you drag 5% out of your body? Can you give that back to me? Because you're asking them a question and they're trying to deliver that back to you rather than, it's not good enough. It's not good. That's not good enough because you're discounting the amount of effort that they're working through. And just because they're trying really hard, sometimes to us, we can't see that effort because if their body isn't ready to produce power yet, it will be slow, but they're trying, and that's the main thing. And power and strength and all those sort of attributes, they might take 6 months to make a big difference to. So it's effort, and it's encouraging effort, and it's inspiring a little bit more effort each time so that then they can jump higher in the next 6 months. So then these are some sample warm-ups with some cues. So we've got a video that'll be attached to this that'll actually just go through each section. So this is some basic things we do. So you'll notice here there's no stretching, and there's not. This is mainly core stability. So we want to work the plane going this way, the plane going this way, the plane going this way. So a front plank is this way, so it's working stability in this pattern here. A side plank is lateral chain, and your back bridge is your posterior chain. Single leg balance, so we've got those in there, we've talked about doing those. So you can see there's only 2 sets. So warm up is about exciting the body, it isn't about fatiguing the body. So we don't want it to be super hard, we want it to be enough that the body gets blood flow increase to the area that's going to work, and we want the body to be excited from a neuromuscular point of view. We don't need to tire anyone out. Then single leg calf raise, so is the last thing we jump with, like pop. This is our pop, like in our jump. So calf strength is related to ankle sprains. So you should be able to do 40 on each leg easy if you're playing netball. Most athletes, not so much, so it's something we try and work on. Technically, we'll explain that next time too, like what you're looking for. But again, you're just looking at if someone is very poor at that and they're not getting better there, the sort of people you want to refer because it can indicate like an ankle problem. This short step split squat. So this is very much around running. So it takes out the complexities of squatting. It focuses on single leg strength and power, and it's about jumping, and it's also about like sprint starting. So again, the video goes through that in its technique. Multi-directional lunge, so forward, side, back. So trying to that's a dynamic balance exercise as much as it's strength, because when you drop into a forward lunge and spring back, side, spring back, it's those sort of netball movements that you do that you want to have an ability to go through multiple planes of motion. And then the jump to a split squat landing is really great in terms of balancing in a split squat landing like this, but making sure that you're doing a big jump. So really trying to improve their propulsion to get up and then land tight, so they're not landing in a soft stance. Again, we go through that in the next video. Then these are some more running ones. So you've got a short step high knee, so nice short foot contacts that's building like plyometric, so reactive power off the ground. Side step shuffle, so moving laterally, stopping, so working the lateral chain, but also lateral knee stability, very important to land. Pendulums are a forward to back, so an acceleration, deceleration tolerance. This is one of the ones we might use, like coming back from a knee injury, so we try and build that speed in acceleration. So it's only over a 3 metre gap, which is about the distance that most athletes sprint in netball anyway. Fast feet reactional, so light on your feet, moving to a stimulus. So then you can use a ball, you can do partner mirroring. Again, we go through that in a little video. And then putting an agility circuit, incorporating the ball. So if you're doing that in a netball context, you can do a catch and pass drill or anything like that. So that's how I would progress like a netball style warm up, going from a little bit of a speed work into that. And you can see there's only 2 sets of each thing. If you do it well, you only need to do 2 sets, and then you're back into netball movements after that agility circuit. You can do that as a training session, but you might do 4 sets of everything. And then aerobic work, so sometimes if I've got a big group, I might get them to jog together as a group because you just get all the talking out of them and you get all of the baggage that they bring to their training session out. Bit of group cohesion, so I tell them you got to stick together. Then that 2 to 5 minutes of work, you can do ball games though. So if everyone's ready to go, just playing catch and pass or just identifying session objectives, you can do dynamic flexibility and do that all in a circle. And then just work really hard on your movement patterns. So instead of just jogging, if you want to get them straight into the core stuff, they can talk when they're doing that core stuff as long as they're doing it really well. I use that as my introduction to session because most of those first exercises I put in that program, they're fairly easy to do as long as you do them well. They can have their little talk. But once they're in the agility, their speed, the leg movement, the speed, I want that commitment to speed, the commitment to agility. So I'm asking them to really concentrate when they're doing it, and then obviously they can laugh and they can talk in between. But you want them to really like dial into what they're doing. So then, in terms of referring, so reasons to refer. So pain that can't be resolved with basic recovery techniques like ice, management, rest. If it's coming back the next session still not really great, then that's a good reason to refer to someone. Dysfunction that can't be resolved within 1 to 4 weeks of supervision and support. So if you're asking them to just be a little better at jumping or landing and you're noticing that's really off, then you might make a decision 2 weeks in, this is just not working. Like, can you go and talk to someone? And then when the realm of participation has been reached and the focus now becomes pure performance. So when you get to that 15, 16 age group and you've done some generalised conditioning work, then sometimes that's when you really need someone in your corner that's looking at physical prep and you become the netball person, because you don't want to be doing both, because if you split your focus, you'll only get half of each, whereas if you just netball and we're physical and we do physical, you do netball, you get a better result. So that's where I would say it's time to go and see someone and really extend yourself. Everyone in that high level, everyone pretty much has someone that looks after their physical prep. Don't be afraid to ask them to go and do it. We try and make prep very generalised in the first 10 to 14 age group, and then once we get on from that, then most of the time you start to individualise a lot more and you start to really target their strengths, and then what are their weaknesses, how can we control for them. And then these are some of the professions that you might need, and the only one I forgot to put in there is probably dietetics, which is very important, especially if you've got someone that isn't eating well or you're worried about that sort of thing. But general practice is a great way to start if you're worried about mental health or anything dietitian, because obviously they have the ability to refer under the Medicare scheme if that's appropriate. Physio, for a musculoskeletal injury, generally I'd go straight to physio. Not saying doctors can't do it, but with GPs being really busy, physio can assess, diagnose and provide support straight away to a musculoskeletal injury. Even if it's serious, they can then refer back to the GP, but at least you get some help straight away. Whereas your GP is probably going to maybe go scan, maybe some medication if necessary, and then probably refer to an allied health person anyway. So sometimes you're better off just going straight down the physio line and getting a straight up diagnosis and work on the rehab straight away. So how to refer? So it's really good if you're sending someone to us, for example, if you email us and just say, this is what's wrong, if we've got questions, we'll ask, but you can give us as much information as you want. I fully encourage people to share what you say to us with your athletes, because then it's a complete transparency. If you're really worried about something and you don't want to put it in writing, you can just ring us if you're doing it to us and just ask, can I speak to you? This is what I'm really concerned about. Can I just talk to you? I don't really want to write this down because I'm not sure about how to say it. And then you just say it straight, and then we can just take that opinion that you've got or that observation you've made, and that's really valuable to us. It gives us some context, so that it'll help us prod questions, especially with teenage athletes. Sometimes you've got to take your time whereas we can get to the point and get the real problem out straight away, and then we can start working on the solution. So we value your opinion, we value your perspective greatly, especially if you're sending someone to us. And don't be afraid to tell us timeframes, don't be afraid to tell us about what you want out of us. If you want them to jump higher or whatever you need, you just tell us. And then that's our job. And then we'd ask the athlete what do they want, and we put that in as well. So these are some contact details for me. I am happy to obviously have conversations with coaches, help you in any way. You can email, you can phone, you can text. Sometimes it's easier to text me if you're texting straight, because if I'm teaching or coaching, it's hard to answer the phone. But we wanted to just put this out there just to give coaches some ideas of what to work on, what to try, and some basic things around injury management, especially for netball, because it's such a sport that unfortunately is a higher risk than some other sports for knee and ankle injury. So if we can help you keep your athletes on the court and help you keep developing your athletes, because we can teach you how to do some really basic prevention, then I guess we've helped you, and you helped your athletes more importantly, have a better time playing sport. Thanks very much for listening.